what is scientific healthcare? So I'm going to ask you guys a question to start out with. And I'm especially point my question at Madeline, who just graduated with a double major in chemistry and biology, and to Kama, who's majoring in health sciences at the University of Nebraska. So here's my question. What is science? What is the scientific method? We'll start out with those two questions. Who wants to go first? What is it? What's science?
Observation.
Observation and what?
Verification.
Experimentation, verification. How about you, Takema? Do you have any other thing to add to that?
Well, scientific method, and I'm thinking like hypothesis, experiment, conclusion, yeah.
Yeah, okay. Come to a conclusion.
Mm-hmm.
So let me ask the group at large here. Is there anything that you can think of, let's go back in history a little bit, that was considered scientific, and was scientific at the time, but has completely been disproven?
Well, used to use leeches, suck the blood out.
So bloodletting.
Yeah.
That's right. Excellent. Yeah. George Washington, I think he might have died from that.
It's possible.
From bloodletting. Right.
Yeah.
That's considered scientific at the time. Okay. Anybody else want to take a shot at that?
Geocentric physics. The world was the center rather than the sun being the center of the solar system.
Very good. We're going way back now, but yeah, that's right. Yeah, Copernicus and Galileo, right?
We're not going to get into flat Earth.
Yeah, that was the next thing. Believe the Earth was flat. Okay. Let's go forward a little bit. How about the 1950s? Now, that's for some of you. That's going pretty far back. What are some of the things they believed in the 1950s? They even advertised it, that they would just cringe now. Anybody know? Anybody remember? It's considered scientific. Wasn't proven, but it was considered scientific.
Well, I know, like some of the food groups was kind of screwed up.
That was really screwed up.
That
really
groups.
wasn't until
And it
about
kinda-
the 80s.
Well, I thought that
Okay.
started in the 50s.
It may have, but the food
Yeah.
pyramid, that was probably more towards the 80s.
Okay.
That was when okay, I'm glad you brought that up though. That's really good, Michael. So the low carb diet, the low fat diet was considered scientific.
Mm-hmm.
What did the low fat diet do?
Well,
What did it do? What did it do to our culture? Created fat people. That's what it did. Okay? So the low fat diet did. There's no evidence that worked. But it was gospel. It was considered gospel. And it was advertised, it was promoted. No evidence that it worked. It was not scientific.
I know when it came out in the 50s that was really bad was the margarine.
Good job. Margarine, yeah. Considered safer than butter.
Right, well, right,
Yeah.
right.
Better than butter.
Better
Good for
than
your
butter.
heart.
Yeah,
Okay?
well, it was worse.
Yeah, it's worse for your heart.
Yeah.
How about this one in the 50s? Smoking is healthy. In fact, pregnant women smoking is healthy for pregnant women.
I don't remember hearing that, but
It was there.
It was there. Sheesh.
Okay, that was in the 50s. Okay. How about this one in the 50s? Lobotomies are an effective way to treat depression, anxiety, and all forms of mental illness. I mean, that's outrageous. Nobody would even think about doing that now. That was scientific back then. That was good science back in the 50s. Okay? So what is that? Now let's move forward just a little bit. Let's go to the 1989, 1990. This is a really good one here. And if you get this one right, I'll give you a bar. Okay? Okay. Give you a bar. Does anybody remember the travesty that was going on back in 1989 and 1990? I'll give you a hint. It had to do with women's health.
Is that hormone replacement therapy?
No, I mean that's That was an okay one, but no, that's not the one I'm thinking about. This is way worse.
Well, I know they came out with red wine was bad and eggs were bad, but you're not going there.
Okay, I'm not going there. Okay,
But
this is a really hard question. Okay, you gotta really have done some reading it. But I'll just tell you what it is, because I don't know if anybody's going to win the bar tonight. Okay, so it had to do with treating breast cancer with bone marrow transplants. Anybody remember that?
uh-oh.
Okay, this is 1989, 1990. In fact, it became such a hot thing in medicine that Congress even got involved and passed a law that insurance companies had to cover it.
Yeah, I know.
There was no evidence that it worked. And not only that, you know why they stopped doing it? It was hurting women. It was not only not helping breast cancer, it was really hurting women. Okay? That was a big thing back then. 1989, 1990, right around there. So, what about during COVID? What was the big mantra that we heard? What was
Science.
follow the science? Okay, follow the science. Well, whose science are we supposed to follow?
Yeah.
You know?
Yeah.
So science, science involves hypothesis, experiment, but can it be wrong?
Oh, yeah.
Yeah. Can it be replaced with something that's actually more accurate? Absolutely.
Sure.
Here's another scientific thing, and then we'll get into the slides. What about the hypothesis that high cholesterol causes heart disease? We'll get into that in a little bit. That ain't true.
No.
This is not true.
No.
Okay. So we'll talk about that in a little bit. So let's get into the slides here. Okay, so we're going to talk about evidence-based healthcare tonight. And this started about 1991 is when it really got going, okay? So the validity of this model depends on a reliable data from clinical trials, most of which are conducted by the pharmaceutical industry. Now, I'm going to show you some really good studies on chiropractic tonight, but most of the evidence-based trials that we hear about, that we see, is now, and this isn't good right here. This is not a good thing. All right. So the integrity of science in an open democratic society requires that scientists don't cling to cherished hypotheses and take seriously the outcome of the most stringent experiments. Now, during COVID, was this going on during COVID? Did we live in an open democratic society which accepted lots of ideas? No. I mean, it was almost Nazi-esque during COVID, okay? About some of the things they were saying and some of the things they were doing. Way worse in Australia, but it was bad here as well. You know, we weren't even allowed to question anything the government was saying. They'd shut it down on social media. So this is an article all of you should read. You can get it for free. British Medical Journal called The Illusion of Evidence-Based Medicine. It came out about 3 years ago. I ran across it when I was on vacation in Florida. And I read it and I thought, wow, this is pretty interesting. But it says this is a quote from this article. Recently released confidential pharmaceutical industry documents into the public domain has provided valuable insight into the degree to which the drug industry has misrepresented their clinical trials. Until this misrepresentation is corrected, evidence-based medicine will remain an illusion. Okay, so you get that article for free out of British Medical Journal. Just look up, go online, type in British Medical Journal into your search engine, and then when you get that, click it, and then it'll have a search engine within British Medical Journal, and just type in something like evidence-based medicine. The article will come up, okay? So there are two primary types of clinical studies. Once you understand, there's observational studies. So you don't do an experiment, you observe things, okay? Observational studies help come up with a hypothesis that can be put to test. However, just because an observational study finds an association between things, that doesn't always prove that one thing causes the other. And that's the weakness of observational studies. So let me give you an example of that. Or can anybody give me an example of that? I'll ask you. Can anybody give me an example of this, where it's an observational study, but it's completely untrue? Where the two are connected, but it's just completely untrue. Anybody give me an example of that? I got a really good one, okay? So, do you think more drownings occur in the winter or the summer? Summer, okay. Would everybody agree with that? Why more people drown in the summer than the winter? Because there's more people swimming. You think people eat more ice cream in the winter or the summer? Summer, right?
Yeah.
Okay. So you could say, well, eating more ice cream causes people to drown. Okay. Well, the two things are true, but they have no relationship to each other at all. So that's how observational studies, just because two things look like they're connected, doesn't mean they are. Okay? That's the weakness of observational studies. Now let's look at clinical trials. This is a gold standard of clinical research. Clinical trials are very, very important, and they do this in the pharmaceutical trials. The problem is these pharmaceutical industries tend to massage the figures until they can get the result they want, and that's where the problem is with this. But you have two groups of people. One's given the drug, one's given a placebo, okay? A blinded study is a researcher knows who's receiving the real intervention. Double-blinded, neither the researcher nor the patient knows. Now, why could this be an issue over this? Anybody?
Well, I mean, you could possibly choose who you're giving what to.
Yeah.
Sort of like, profiling, Well, they don't look in very good health, or they look in better health. This is pretty hard on people. Let's give it to the good guy and give the placebo to the person with bad health, something like that,
Very good. Very, very good answer. Yeah, that's true. And just the way that you talk to a patient, if you know that they're getting a drug or they're not getting it, could actually influence the outcome of that study. Okay, so double-blinded studies, you don't have that. All right. So I'm going to talk about the first chiropractic study that was ever done. This is a very, very good observational study. So Windsor autopsies, published in Medical Times Journal, 1921. So Henry Windsor was a medical doctor from Philadelphia who was at the University of Pennsylvania. And he observed that people that got chiropractic care and osteopathic care just did really well, better than a lot of other patients. So he wanted to find out why. So he planned an experiment. He would do autopsies on both humans and animals to see if there's a relationship between the health of the spine and any diseased organs that he found. And so he dissected 75 human, 22 cat cadavers and found 221 diseased organs between the two of those. Okay? So he found nearly 100% correlation between minor curves of the spine and diseased organs. All right? And here's what he found. And I'm just going to summarize this. When there is a curve in the upper thoracic spine, there's always a diseased organ of the heart or the lungs. Always. Okay? When it was the middle spine, because if you look at this, the upper part of the thoracic spine goes to the heart and lungs. The middle part goes to your upper visceral organs like your stomach, your liver, pancreas, gallbladder, and the lower part goes to the lower GI tract, your abdominal and your lower abdominal and pelvic organs. So he found out that in the middle back, when you had curves in the middle back, they always had stomach, gallbladder, or kidney in the lower thoracics. And in the lower part of the spine, when there are minor curves in there, is prostate, bladder, prostate and bladder, and then pancreas and liver in the middle. And he found this very, very consistently. So certain parts of the spine, you had certain diseased organs. This goes right along with the autonomic nervous system. Here's what he said in his study. It's rare to find an organ disease which was not supplied by the same sympathetic nerves as the vertebra and the curve. Many of the organs showed acute disease, while the deformed vertebrae were older in nature. So the spine had degenerated to a certain point before the organ got disease, which proved that the curvatures preceded the disease of the organ. Okay, did that make sense to everybody? Okay. So disease appeared to precede old age and then cause it. The spine becomes stiff and old age follows. Therefore, we can say a man is as old as his spine. All right? Now, when you start getting you can get degeneration in your spine long before you even know it's there, because it's insidious, it's slow, and it doesn't necessarily cause pain. That's why chiropractors are always telling people, keep up with your adjustments, keep up with your exercise, because you don't know, because osteoarthritis of the spine is insidious and it doesn't necessarily cause pain. Now, here's an interesting study. This is in Journal of Manipulative and Physiological Therapeutics, October 2010. Chiropractic adjustments versus disc surgery. Okay, so the purpose of this study was to compare the clinical efficacy of chiropractic adjustments against disc surgery in patients with sciatica, secondary to lumbar disc herniation. Did a randomized clinical trial. So it was a first study to directly compare the efficacy of surgery against chiropractic spinal manipulation. Never been done before. And these had failed all other medical management interventions. So after failing 3 months of traditional conservative care, analgesics, which is, aspirin, opioids, whatever, lifestyle modification, physiotherapy, massage, and or acupuncture, the 40 patients were randomized into 2 groups, okay? One to either a surgical microdiscectomy or to chiropractic spinal manipulation. All of the patients were deemed by the physicians as surgical cases, all right? Patients were assessed at 3, 6, 12, 24, and 52 weeks after treatment was initiated. After 12 weeks, 60% of the 20 manipulation group demonstrated clear improvement in outcomes and continued to complete the 52-week follow-up period. Now, remember, these people were supposed to be surgical cases. And I've seen some of those people in my office. People that I sent to a surgeon, I thought they were surgical cases. Surgeon wanted to do surgery. Patient didn't want surgery. They came back to me and said, no, I want you to keep working on me. And I saw them get better. Okay, saw some really serious cases get better. Cases that I didn't think would get better, but they got better. Okay, I don't have time to tell you those, but they're pretty amazing. Of those who failed spinal manipulation treatment, which is about 40%, it looks like, subsequent surgical intervention provided excellent outcomes. What does that tell you right there? Anybody?
Well, with proper care, the body's capable of healing itself.
Feels a lot better after surgery. That chiropractic care really helped these people with their surgical outcomes a lot better. That's what it says. Okay? So even though chiropractic care didn't cure them or fix them or get rid of their symptoms, their surgical outcomes were a lot better because of it. Okay? So here's a study at the University of Iowa, not 2014. It demonstrated that based on Medicare patients, seniors under chiropractic care had fewer functional limitations, less difficulty in engaging activities such as lifting and walking, lower number of doctor visits and hospitalizations. They concluded that chiropractic had a protective effect, safeguarding them against physical deterioration. Now, I'm in this age group, okay? And I've been under chiropractic care since I was 23. And it's, for me, it's been tremendous in terms of keeping me healthy. So I know that there's a lot of truth to this study. Chiropractic and pregnancy, I'm not in this group, okay? It's just, So there's 115 pregnant women experiencing pain in their back or pelvic region, had not engaged in chiropractic care in previous 3 months, were not restricted from participation. So they adjusted these women. Here's what they found. 1 week into treatment, 52% noticed a reduction in pain. 1 month into treatment, 70%. 3 months, 85% were happy with the results. 6 months, 90% noticed a reduction in pain. 2 other studies on chiropractic and pregnancy revealed that pregnant women under chiropractic care had half the delivery time compared with women with no chiropractic. That, to me, is the amazing thing right there. So, anybody in here tell me why that might be? Why would that be? Why do they have half the delivery time?
Body's more prepared for the process of birth.
Okay, and why?
You have more flexibility in the pelvic region so that you have the ability to do the adjustments required for birth.
Yeah, so if your pelvic area is locked up and you unlock it, it's going to deliver babies better. There's another reason too. The uterus has a nerve supply that comes out of the spine, okay? That nerve supply is interfered with. That uterus, which is basically a muscle, cannot function properly. So there's 2 reasons. Nerve supply and the actual physical limitations of the pelvis that's locked up. Okay. Annals of Internal Medicine. 192 patients with back-related leg pain. Half were given chiropractic care with home exercises and advice. Half were given only home exercises with advice. The chiropractic patients were given 20 visits over 12 weeks, which is not a lot of visits over that period of time. At 12 weeks, the chiropractic group had less back pain, less disability, and better all-over improvement in patient satisfaction. At 1 year, the patients who received chiropractic maintained their overall improvement and satisfaction. There's 2 studies, one in Canada, the other in Tennessee, showed that on the average, chiropractic care was 40% less costly than medical care. Patients were much more satisfied. This is, again, JMPT, Journal of Manipulative and Physiological Therapeutics, November, December 2010. Here's one called Out of the Archives of Physical Medicine and Rehabilitation. 40 men were diagnosed with degenerative disc disease. Half were treated with chiropractic adjustments, half with a placebo adjustment. Results from patients who received a single adjustment: less pain, increased spinal mobility, better hip flexion, and had a significant measurable increase in height. There's chiropractic in the workplace, okay? There's 2 studies in the Journal of Occupational and Environmental Medicine. 17% of U.S. workers have absenteeism as a result of musculoskeletal conditions. Chiropractic care offered on-site at the workplace showed improvement in both pain and functional status, lowering of overall health costs. Workers used fewer drugs and had less physician visits, reduced absenteeism, increased employee productivity. So you question, why wouldn't most companies have a chiropractor on the job? I'll tell you why. I heard this from an HR lady. It's because anytime a worker has an accident or a problem and they report it to a doctor, that's reported to the government in terms of government statistics. And once you get the government involved in your workplace, you have too much of those, they really start investigating you. So they don't want that, okay? Even though this is helpful to them, you know, companies don't want workers that have problems coming to them and saying they've got this issue because if they have a doctor on staff, they end up having to report it as an injury. So this was cervical disc herniation and neck pain radiating into the arm. This was 50 patients who were treated in a chiropractic office. Again, this is more of an observational study. They had patients fill out pain reports after they were being adjusted, and the patients in the study had neck pain with moderate to severe arm pain. They were given adjustments at 2 to 4 times a week, which is a pretty good care, pretty good number of adjustments. At 3 months, almost 86% were significantly improved. So it was 2 to 3 times superior to published studies of patients receiving a cervical nerve block with steroids. Here's another study that showed that biochemistry changes when you adjust somebody. Purpose of the study was to evaluate the effects of cervical and thoracic adjustments on the blood values of neurotensin, oxytocin, and cortisol, which are pain suppressors. And they found out that this study, that it changed these chemicals went up when adjustments were given. They changed for the better. Medical Science Monitor, this is February 15, 2016. This is what happens when an individual loses their cervical curve, okay? It causes disruptive biomechanics, triggers degeneration or osteoarthritis, causes neck pain, upper thoracic pain, shoulder pain, headaches, and poor health-related quality of life. This is why I just hound my patients to do their cervical traction exercises, because they're trying to get that curve back into the neck, and this is the reason. Loss of cervical curve also causes decreased blood flow to the brain due to changes in the vertebral artery, which runs along the side of the vertebra, goes up into the circle of Willis, into the base of the brain. So there's a normal cervical curve, there's a loss or a reverse cervical curve right there. So people that come in here to my office with these get cervical traction exercises that I hound them to do because I want them to get as close to this as possible because of the outcomes, much better outcomes. So here's chiropractic and migraines. This is in the complementary therapies in medicine. 3 groups of migraine patients. One received chiropractic and drugs. One group received a sham adjustment and drugs. One group received drugs only. The study lasted 6 months. After 6 months, the manipulation group, the group that got chiropractic care, were able to reduce their drugs by 80%. That does not surprise me, considering the number of migraine patients I've treated. Their migraines were reduced by 97%, their functional disability by 100%. The medical group plus fake adjustment, they reduced their drugs by 68%, their migraines reduced by 17%, and they had a 33% reduction in functional disability. The med-only group had no reduction in medication after 6 months, only a 1% reduction in migraine headaches, 0% reduction in functional disability. Now I'm going to ask you a question. Why did the fake adjustment group do so well? Why did they do? Because they got a fake adjustment and they were taking meds. They did way better than this group. Why is that?
Placebo effect?
Yeah, that's one reason. Good job. Yeah, placebo effect. You know, they thought they were getting something. So that really goes to show how much your mind, your belief system
Mind
has
over matter, yeah.
yeah, on your health. But here's another thing. I think it has the power of human touch on another person. People like to be touched, period. You know, everybody does. Most people do. And so it's the power of human touch. I think that has something to do with it as well. So Heidi Havoc, she's one of the premier researchers in our profession. She's published lots of great articles on chiropractic, very scientific articles. Here's what she found, that when we adjust somebody, it actually affects brain function. It changes the way the brain works. So here's what it says, subluxations cause abnormal feedback to the brain, which causes abnormal brain function and abnormal feedback to the body. This causes poor control of spine and body, leading to pain and loss of function. It changes balance control, reaction times, depth perception, increased muscle fatigue, and loss of muscle strength in the leg. So according to Dr. Havoc, most interesting thing that came from her research is that chiropractic care, adjusting the spine to restore spinal function, actually changes the way the brain functions. Okay? And you can look her name up in PubMed. Just type in her name in a search. It'll show you all the articles that she's published. Okay? Dr. Havoc found that a single chiropractic adjustment positively alters all sorts of processing in the brain and central nervous system, including how the brain controls muscles, how the brain increases the strength of muscles, how the brain reduces muscle fatigue, and it improves immune and endocrine function. Now, the last thing I want to talk about, really important, is the concept of number needed to treat and number needed to harm. Has anybody ever heard of this? Okay, I didn't think so. Nobody ever has. Okay, have you ever heard of it? Sort of. Okay, how about you? No, okay. Really, it's a super important concept in especially pharmaceutical research. I want you to understand this. And I'm going to let you go. The number needed to treat is a number of people that have to be treated with a particular therapy to get one